Navigating through Medicare.
Hello, my name is Professor Medicare. I love helping people navigate Medicare, and that's what we're going to do today. We're going to talk about the parts of Medicare: Original Medicare, Medicare Advantage, Medicare Supplements, Part D, some questions that you may have, and next steps. There are 4 parts of Medicare: Part A, Part B, Part C, and Part D. Part A helps cover your hospital costs. Part B helps pay for your doctor's visits and outpatient care. Part D is a Medicare prescription drug plan, which helps cover your prescription drug costs. Part C is a Medicare Advantage plan, and it includes Part A and Part B and sometimes Part D. To qualify for Original Medicare, you need to be 65 years old or under 65 with a qualifying disability. You need to be a U.S. citizen or legal resident in the United States for at least 5 consecutive years. For enrolling in Medicare, you have a 7-month window that starts 3 months before your birth month. It includes your birth month and then 3 months after. If you choose to continue working after you turn 65 and you have critical coverage, when you decide to leave that coverage, you have 63 days to enroll in Medicare A, B, and D to avoid a penalty. Enrollment in Medicare Part A and B is automatic if you're already receiving Social Security payments. You're entitled to Part A at no cost as long as you have worked and paid in for at least 40 quarters. Part A has a deductible of $1,556. If you were to stay in the hospital for 1 day or the whole 60 days, that is your deductible for Part A. Now, if you go back into the hospital later that year, you may have to pay that deductible again, which is not like the traditional calendar year deductibles that we're used to. The co-insurance for days 61 through 90 is $389 per day. For days 91 through 150, it's $778 per day. Beyond days 150, you would be responsible for paying for that yourself. Skilled nursing is a benefit under Part A. The first 20 days are covered at 100% by Medicare. After the 20th day, you pay $194.50 per day. Part B has a calendar year deductible of $233. After the deductible, Medicare pays 80% and you pay 20%, and there's no maximum out of pocket with Original Medicare. The premium for Part B is $170.10 per month, but that could be more based on your income. Medicare looks back 2 years, and if your household income is over $182,000 a year, or your individual income is over $91,000 per year, then your premium would be higher. You can find your income on this chart, and it will show you what you can expect to pay for Medicare Part B each month. Most people add additional coverage to limit their out-of-pocket expenses for the year. The first type of coverage that we're going to discuss is the Medicare Supplement, sometimes referred to as a Medigap plan. Medicare Supplement plans are secondary to Medicare. Medicare pays first, and if Medicare allows that charge, then your supplement will pay the rest. They have a monthly premium that you pay as well as your Part B premium. There is no network, so any provider that accepts Medicare will accept your supplement. They do not include prescription drug coverage, so you will add that in a separate plan. We will talk about prescription drug coverage later in this presentation. There are several supplements available, and they vary in the amount that they pay towards your deductible and the 20% coinsurance. For example, a Plan G would cover your inpatient, Part A deductible, and the full 20% of your Part B costs in or out of the hospital. You would be responsible for your Part B deductible of $233 per year. If you had a Plan G and you had $1 million bill at the hospital, your portion would be $233 plus the premium that you pay. Keep in mind that a Medicare supplement will increase your flexibility and lower your risk. However, it comes at a higher premium that may increase over time. Another option that you have is a Medicare Advantage plan, also known as a Part C. Medicare Advantage plans take your Part A and your Part B and usually add Part D all under one umbrella. There are no health questions to qualify for a plan, and there is little to no premium. You have to live in the plan service area and maintain your Medicare Parts A and B. Every Medicare Advantage plan has a maximum out-of-pocket, which is one of my favorite things because you know that there's a cap. They also have fitness programs available. They can include dental, vision, and sometimes hearing, and they also all have worldwide emergency care. There are different types of Medicare Advantage plans available, and the county you live in will determine which plans you have access to. So it's good to look at your specific zip code to find out what plans are available to you. Here's a visual to show what we've just talked about. Medicare Advantage is able to cover some vision, dental, hearing, and out-of-pocket spending limits, all in one plan. With Original Medicare and a supplement, if you want vision and dental, you would add a separate plan for those. And on the far right, you'll see that Original Medicare will cover their portion of your medical expenses, but doesn't have a limit to what you could spend out of your pocket and doesn't include prescriptions or the extras like vision and dental, so you would enroll in those separately. The next thing on our agenda is Medicare Part D, which is a prescription drug coverage. First, I want to mention the cost of Part D. Similar to Medicare Part B, if your income is over a certain limit, you will also pay extra for Part D. This will apply to you if you have a standalone drug plan or if you get your drug coverage through a Medicare Advantage plan. Medicare creates a blueprint for prescription drug plans that all the insurance companies that offer them have to follow. They lay it out in stages. You have a deductible stage, an initial coverage stage, the coverage gap or the donut hole, and then you have catastrophic coverage stage. So the first stage is the deductible. The deductible for 2022 is $480. You pay 100% of the cost of your medications until you reach $480. Next, you enter the initial coverage period. During that time, you pay your part, which is your copay or your coinsurance, and the insurance company pays the rest. Now, the insurance company is going to keep track of everything that they spend and everything that you spend. And when the total becomes $4,430, you have reached the coverage gap or the donut hole. Now, instead of paying your copay or your coinsurance, you're going to pay a flat 25%, whether it's a brand name or a generic drug. When your total out-of-pocket costs reach $7,050, you go to the next stage. But I don't want to go there just yet. Some people think that the difference between the $4,430 and the $7,050 is all you have to pay. But during this time, they only take into account what you have paid out of your pocket. So if you paid the deductible and if you paid your copays, then you get to start the coverage gap with that amount, not with the $4,430. So now you're going to pay for your medications 25% at a time until your out-of-pocket costs reach $7,050. The discount here is coming largely from the pharmaceutical companies, and Medicare allows you to credit that discount towards your out-of-pocket costs. So if you take a name brand drug, it may help you get through the donut hole a little bit quicker. Once your out-of-pocket costs have reached $7,050, you will go into the catastrophic coverage stage. During this stage, you will either pay $3.95 for generic drugs or $9.85 for brand name drugs, or 5%, whichever's higher. Once the year is over, then this wheel starts over again and you will start with your deductible. Now we're going to talk about some terms for Medicare Part D. Every prescription drug plan has a tiered formulary. They go from Tier 1 to Tier 5 and sometimes Tier 6. Tier 1 being the lowest cost and Tier 5 or 6 being the highest cost. The next term is step therapy, which requires you to try one or more similar lower cost drugs to treat your condition before the plan will cover the prescribed drug. It really protects your pocketbook and the insurance company. Some medications have quantity limits, so plans may limit the amount of prescription drugs that they cover over a certain period of time. If your medication is not listed in your plan's formulary, or you're needing to take more than the quantity limit, you can request an exception. Every prescription drug plan also has a network of pharmacies. Make sure that the pharmacy that you prefer is listed in your plan's network. Here are some important things to know. You could incur a penalty if you do not enroll in your Part B or Part D when you're first able to do so. Credible group coverage gives you a special election period to enroll at a different time. It's important to know that custodial care is not covered by Original Medicare, Medicare supplements, or Medicare Advantage plans. You might look into getting a short-term or long-term care plan to help with those future expenses. In addition to the plans we've talked about today, there are other plans that can assist you in paying your copays and your coinsurances. No matter which plan you choose, there can be gaps that leave you paying copays or having out-of-pocket expenses. There are extra plans offered to help with those expenses. These gaps could be hospital copays, skilled care, nursing care, and unexpected costs that come with cancer, heart attacks, or a stroke. The plans that we have to fill these gaps are known as indemnity plans. These plans pay a specific amount for services or illnesses to help cut back on your financial responsibility. Like most insurance, you have to get these plans before you need them. We've listed some questions that we often get. The first one is, what if I work past 65? As long as you have coverage through your group insurance or someone else's group insurance, that can be considered credible coverage. You can delay your Part B until you're ready to retire. Just make sure that you talk to your company's group coverage administrator or human resources to make sure that your coverage is credible if you are unsure. What if your spouse is younger than you and they're covered under your group plan? The best thing you can do is talk to your group's administrator and find out if there's an option for them to stay on your group's plan once you retire. If that's not an option, when you go to Medicare, it may affect your spouse's coverage. What if you plan to move? If you decide to move, that initiates a special election period for you to change your plan. Remember, we talked about how a lot of these plans are specific to the county that you live in. So whenever you move, make sure that you pick a plan that's offered in your service area. What if I travel frequently or have two homes? There are plans that are more suitable for someone who travels a lot or has multiple homes. Make sure to mention that whenever we meet. Can I choose my own doctors? The answer is yes. Now, depending on which plan you have, you may have a selection of doctors to choose from, but you get to choose. Our goal is to make sure that the doctors you use and the medications that you take are able to stay the same. Is there financial help available? Yes, there is financial help available. There's the Medicare Savings Program that can help you with your Part B premium and some of your coinsurance. And there's also the Extra Help Program that can help you with your prescription drug costs. If you find that you need help, reach out to us and we can help you apply for these benefits. If you have Federal Blue Cross and Blue Shield, it is not considered credible for your Part B once you retire. So make sure that you add that upon your retirement. What if you're a veteran? Well, first of all, I would like to say thank you for your service. Your priority group will determine the level of benefits that you have with the Veterans Administration. The coverage that you get for prescription drugs is credible for Part D, so you are not required to get a prescription drug plan, and you won't be penalized if you choose not to. On the health benefits that you get through the VA, they are not considered credible for Part B coverage, so you'll want to go ahead and add your Part B whenever you are able to do so. Alright, now we're going to talk about the next step for getting set up for Medicare. The first thing you need to do, if you haven't already done so, is to register for an account at ssa.gov. After you've done that, you'll be able to enroll in Parts A and B of Medicare online. Once enrolled in Medicare, you'll receive a letter with your Medicare number, and then you'll receive a Medicare card. This card will be red, white, and blue. Once you receive your Medicare card, you can go to mymedicare.gov and create an account there as well. If you choose to continue work and just enroll in Part A, you are able to do that online too. The next thing to do is to choose what type of plan you want, and that's where we come in. We do not charge for any of our services, and there is never an obligation to enroll. We are paid by each insurance company to be your agent and assist you going forward if you choose to enroll in a plan. You can call us at 405-842-0494 to schedule an appointment for us to help you out. Our home office is located in the village. We're located at 2232 West Hefner Road, Suite A. We're right next to the post office. We have agents all over the state, so we can come to you if you prefer. Again, our phone number is 405-842-0494, and you can visit our website at navigatingmedicare.com. Thank you for taking the time to join me today. I look forward to seeing you soon.
Navigating through Medicare.